So my topic's going to be on basically like medical emergencies on like airplanes. So the FFA the FFA has a I guess they have like a document out which kind of tells all the airlines what they need to have. So every airline has a first aid kit, and that depends on kind of how many passengers are in there. They have an AED, and then they have an emergency medical kit. So the emergency medical kit is what we're interested in, because that's kind of, you want to know what resources you have if you do respond to an emergency. So first off, who's allowed to use it? So most of the data actually on this shows that they don't actually call a lot of medical emergencies, because the flight attendants usually take care of most of the stuff using the stuff in the first aid kit. So the flight attendants can do CPR, they can use AEDs, but they're not like they're not your nurses, so they can't give meds, they can't put in an IV. They actually decide who gets to use the emergency medical kit. So even if you tell them I'm a doctor, if you don't have your ID on you, they can refuse to let you help out. And then in the actual paper, they have a whole thing, just like this is a quote from their actual the bulletin. But basically, if there's a critical emergency and they can't find anybody, then they don't need to do anything. It's not like they have to go through any extreme measures. Yeah. So the first aid kit is pretty basic. They have some alcohol swabs, a bunch of bandages. They have some tape, scissors. They have these ammonia inhalants, so I guess if somebody passes out, they'll just like bring this in front of their nose and try to see if they wake up.
It's like smelling salt.
Yeah. And then they have an arm splint and a leg splint, so I guess you could try to see if that'll do the trick. And then, so the emergency medical kits, these are the things that if they do call for a doctor, these are the things that you'll have available to you. So you'll have one pair of gloves at least, so hopefully you don't rip it when you're putting it on. You have a blood pressure cuff and a stethoscope, so you could take a manual blood pressure. And then you have like kind of airway equipment. You have like OPAs. They have basically three sizes for everything. They've got a ped size, a small adult size, and then an adult size. They have a BVM, and then they have a CPR mask. Then they have basically IV starting stuff. So you have a tourniquet. You've got 2 alcohol swabs. They have like basically a kit. So they don't actually specify what is in the kit. So it depends on which airline buys it from who. But they just say that there needs to be tubing with 2 Y connectors. They only have 500 cc's of saline. Then they have tape and scissors. Yeah. So it doesn't say what gauge needles you have to have. They have needles and syringes. So I don't know if these needles are actually IV catheters or if these needles are actually just syringes, like the needles for the syringe to pull up meds. Yeah. So basically, they've got a couple of needles. Hopefully, they're IV catheters. But I don't know why you would need an 18 gauge in an airplane, though. But you've got syringes, and then they have this kind of little clause in there, so the airlines can decide what type of syringes they need based on whatever meds they have. In terms of the medicines that they actually have, so these are kind of the meds that are required. So they have basically 4 tablets of Tylenol. They've got some antihistamine both in tablets and injectable form. They have atropine. You have aspirin. You have 4 tablets of aspirin. You have a pump, an asthma pump. You have 1 ampule of D50. You've got both EPIs. Then you have lidocaine and nitro. So the lidocaine is actually, so these are the reasons as to why you need the meds. So if you look at the lidocaine reason, it's basically like in ACLS now, we can give amio if you're worried about VFib. These recommendations are all, like this paper or this bulletin that the FFA put out is from 2006. So this is a little outdated, but this is kind of still what they're using, and they don't have there's no plans at least to update this at any point. They do have basic instructions for use of drugs, so if you get scared, at least you can pop up the little thing and figure out why you need each med. So I was looking at a couple of, I guess, people who have responded and seen kind of what their criticism is of what you have available to you. So one thing is glucometers aren't mandated. So even though you have D50, you would just have to give it empirically, or you could ask somebody on the plane if they have their own glucometer on them. A lot of people said that it's really hard to listen in the airplane when you're trying to take that blood pressure. So what people were saying instead was you could just use the palpation method. So you'll blow up your cuff, but instead of listening, you'll just kind of feel for the pulse, and then when it comes back, you'll use that. While they have an AED, they're not required to have the AED with an EKG screen on it. So it's not like you're going to be able to tell the underlying rhythm. So if it's cardiac arrest, that may be a little bit hard to figure out exactly where you're at. In terms of the portable oxygen tanks that they have 2 settings, low flow and high flow. High flow is only 4 liters, so that may not be what you need. Then the other big thing is that there's no requirement that the tubing that they have for the oxygen has to actually connect to the oxygen tanks. So there have been cases of people trying to give somebody oxygen, but it doesn't actually connect to anything, so that becomes an issue.
Duct tape.
And then if you remember from the meds, there was really nothing in terms of any benzos or anything for seizures, so you may not be able to break a seizure either. Now again, this is kind of the FFA's requirement. Some airlines go ahead and supplement this and get their own stuff too. So some airlines go ahead and buy their own meds or their own packs. So you may actually have more meds than this, but this is the only required thing. So if they don't have anything else, this is what they will have.
A lot of cases in the news, though, where children have gone into anaphylactic shock, and the airplanes have not had epi on board.
So,
Passengers
yeah. So they're required to have epi, and a lot of the cases actually were. There's a couple of cases of like some pharmacists who responded. There's a couple of cases of like a bunch of people who responded, but they didn't know that the airline actually has an emergency medical kit.
Yeah.
So what happens is a lot of the cases they come out with the first aid kit because they already brought it, but unless the doctor specifically asks the flight attendant to go grab the emergency medical kit, they don't grab it. Again, remember, these aren't people that are trained in any medical. They have like no medical background either, so they may also be a little scared during the thing. So it's not like they're thinking ahead, like, oh, I have something that's ready for this.
I actually disagree with that, because most of the time, flight attendants take care of the emergencies without calling overhead.
Right.
They're actually more than equipped to handle most of these.
That's the first slide.
Yeah. So that's true. But most of those cases are the first aid kits. Those are the ones that need either like a Band-Aid or they need a compression, they need a dressing, one of those. Not in terms of anything that they go to the point of calling for an emergency.
So if people campaign to try to, because it sounds like EpiPen seems like an obvious one, and it sounds like Narcan in today's day and age, like nasal spray or IM, seem like no-brainers, right?
Right.
Like,
Yeah. So there's a bunch of articles of people like kind of discussing all these missing steps, but I guess, I don't know, resources, money, whatever it is, it's not on their agenda at any point soon to go back and reassess this 2006 guidelines.
The other question, is there any, so I actually was confronted with this, where do you actually perform CPR? So I was on a night flight where I thought I'd have to start CPR on somebody, and I was debating on this 200-something pound guy whether we're going to try to put him in the aisle or we're going to try to do it in his middle seat.
Yeah. No, it's true. Yeah.
No, it was legitimate, and believe it or not, it was coming home from an ASAP conference from Seattle. I was the only one responding.
Oh.
You know, so.
Yeah. Yeah. No, it's true. So some people say that actually in that bulletin, one of the other things they say is you can use able-bodied volunteers to help you move somebody to a better location. So aisle is okay, but they actually recommend either all the way in the front, like right behind the cockpit, because there's a little bit more area there, or all the way in the back. One or the other. The front they recommend because the stretcher is a lot easier to get somebody off from the front instead of having to bring somebody all the way to the back and bring them out.
The situation was really like, so if someone's in cardiac arrest, imagine how much time it would take to get them out of the seat and back to the front or the end, or even just to get them out of the seat and into the aisle, and then how can you resuscitate them in the aisle was like...
They're tiny.
Logistically, it's just one of these things you think about. Like,
yeah, no, it's true.
Just on the EpiPen, because we're talking about dosages and amounts. I'm sure most people know this, but every EpiPen has more than just the dosage you've issued. And if you look on Mark Silverberg and Downstate, just Google it on their YouTube.
He broke the pen up and showed how to.
That's great. How do you actually take apart the EpiPen and you can get up to 5 doses out of it?
Yeah. Yeah, it's something you need to do beforehand so you know exactly how to use that. But it's a great video actually.
Yeah, it's a very good video.
So this was like a study back in like 2000 that they looked. No, it's made to give one.
And then you're locked out of being able to use it, but if you actually can take it apart.
But there's just like 4 cc's extra.
Yeah, in there.
Why?
It's just the way it is. There's a lot more epi in there than you need.
Because people don't hold it down long enough, and that's a way to make sure that they're more likely to get the perfect dose.
So this is just they broke down kind of all like the most common emergencies that were called. So as you can see, GI was kind of the biggest one. Most people ended up just having gastro.
Too many alcoholic beverages.
Yeah. So just like this lady right here. So just gonna go through a couple of the most common ones. So you'll get called for kind of abdominal symptoms. Diarrhea, vomiting are usually the most common. The biggest thing that you need to do is obviously confirm the diagnosis. You know, we're EM people. Don't just think, oh yeah, it's GI done. Like think about if there's any other concerning stuff. The other thing is, remember, if you look at that list, there were really no antiemetics and no anti-diarrhea meds on there. So it's either you hope that the airline actually has a supplementary pack, or you may just ask somebody, is anybody carrying Zofran? You do have you have 500 cc's of fluid, and then you can always consult a ground. There's something called the ground consult, which is kind of one of their physicians. So you can always call them for a consult. It's probably better for legal. Legally, it's better because remember,
I think they're going to make you speak.
Mandatory?
Yeah.
And then your biggest decision is going to be: do I need to divert this plane, or can this person wait till the flight's over to get treatment?
The ground consult makes that decision.
Yeah. There's a lot of involvement
With them to figure it out. Asthma is another big one. So again, they have an MDI. You do have the oxygen you can give them, and then worst case scenario, you do have epi. Those are kind of going to be your biggest things that you can use for somebody in status. Allergic reactions, again, you have the antihistamines, so you can give them oral or injectable, and then you do have the epi. You can also, you could ask somebody on the plane if they've got an EpiPen on them. Chest pains, remember you have your aspirin, you have nitro. You can hope that the AED on your plane has a monitor, so you can get a rhythm, but otherwise that may be an issue. They're actually trying to come out with new monitors for all the flights for the AEDs, which are kind of just, it's like a telemonitor. So the ground consult will be able to see everything, and it'll have all your stuff on there. So it'll have your vitals, it'll have your blood pressure, your respirations, your sat, and the actual rhythm. So that would be really helpful. Collapse, normal things, check their pulse, check their blood pressure. These are things you can do quickly. You could try the little ammonia tablet if you got it. You could empirically give them D50, but obviously if it's cardiac arrest, then you're going to have to go down your stuff. So you've got the CPR stuff, you have a defibrillator, you have stuff to start an IV, and you have some of the ACLS meds. You only have like 2 rounds of epi. And again, remember, they have Lido, not amio. So if you have VFib, you're going to end up going with Lido instead. This is also another criticism, is that they only have D50, right? So if you don't have a line, it might be a little bit hard. They don't have like glucagon. They don't have any of the other kind of stuff, paste, yeah. Head injuries. So this is actually very common, which I didn't realize. But how every time they say, please use caution when opening overhead bins, the stored items may have shifted. So this actually happens quite a bit. Apparently a lot of baggage falls on a lot of people in the aisle seats. So, your thing, obviously, evaluate them, decide if you think it's anything serious or not. Psych issues, it's not really much you're going to be able to do in this, but remember, a lot of people have anxiety, a lot of people have phobias, and then, there might just be a lot of people who have psychiatric illnesses. Maybe they put their meds inside of their checked baggage instead of their carry-on. A lot of people are drinking on this, and then you may always have somebody who smuggled drugs. It's not really much you can do. You do have Benadryl IM, so I guess that'll be your go-to if you need something for sedation. And then one of the biggest things, I guess, that we always think about is like legal ramifications, right? So what does this mean, like if you do respond? So at least in the U.S., you're not legally obligated to provide medical service, which is, I guess, why most people didn't get up on that flight. But in the U.K. and in Australia, they can actually press charges if you didn't respond, and they know you're a doctor. Ethically, you probably should, but again, depends, if you've been drinking or if you took like some sedatives before the flight, then maybe it's not the best idea. And then again, I would use the ground consult option. I don't know, I guess maybe it is mandatory, but it's better to always just have another consult with you, and that way you guys can make the decision together. There is this Aviation Medical Assistance Act of 1998, which protects you. Basically says you can help out, and then the only reasons that it wouldn't protect you is if you're like grossly negligent or if you have willful misconduct, which is kind of the same as, I guess, us now. the Good Samaritan laws, basically this act allows you to use the Good Samaritan laws in air. They do, almost all the state ones say that if you got paid though, then it doesn't count anymore, then you're not a Good Samaritan. Now most of the people who have like written posts or anything about responding say they do get some sort of voucher and that it's not an issue because they write it in the voucher that this was not for the medical care, this is just kind of helping you out as a volunteer. But you probably shouldn't accept any reward if you want to be really safe. And then, same thing as always, documentation. There is apparently a medical form that the airline has to fill out anyways, so they recommend just taking a picture of it and keeping it for your records.